Morning, good afternoon, everybody. I'd like to welcome you to the HSC Diversity Series, co-sponsored by the Diversity Mavens. My name's Tamai Webb, and I'm chair for the Diversity Mavens, and I just want to welcome everybody. I see a lot of friends here, a few Mavens in the audience, and just welcome to our first Black History Month kickoff presentation. Today, I'd like to also let you know that Dr. Brian Gibbs, who is our new Associate Vice Chancellor for Diversity for the UNM Health Services Campus and Assistant Professor of Family and Community Medicine. He is a new employee here. He's welcomed by the Mavens and the HSC Office of Diversity, and I'd like to present him, and he will do the introduction for our speaker today. Dr. Gibbs, his role in assisting the Office of Diversity in its mission to improve faculty and student diversity, promote a climate of inclusion, and improve community partnerships that yield better health outcomes and access to timely and culturally competent health care. Dr. Gibbs, welcome.
Thank you, Tamaya, and good afternoon, everyone. Tamaya, I'd like to publicly acknowledge you. Thank you for your leadership, your commitment, your persistence, your drive, your determination, all the different ways in which you've helped to elevate an emphasis on diversity, particularly that which relates to staff. And also the Mavens who come along with her. I'd like for you all to stand and be recognized. I'd also like to thank Dr. Romeo Leggett and the Office of Diversity for their commitment, their leadership, and the manner in which they go about elevating diversity and inclusion here across the Health Science Center. I know firsthand that Chancellor Roth was extremely excited to have been invited by the Mavens to be today's speaker, and he was looking forward to being here today. And when he realized he couldn't, he was not only disappointed, but he was also extremely thoughtful about who he could not just get to represent him, but truly respect the invitation that came to him. Someone who could bring high definition to an extremely important topic, African American health in New Mexico. He reached out to Dr. Leslie Morrison, who was willing, able, and extremely well suited to answer the call. Dr. Morrison is the Vice Chancellor for Academic Affairs at the University of New Mexico Health Science Center and Professor of Neurology and Pediatrics. She has an active NIH research funding to study cavernous malformations in Hispanic families of New Mexico, and still has an active clinical practice for cavernous malformations and pediatric muscular dystrophy. In her role as Vice Chancellor, she is working collaboratively toward improved equity for all faculty, making the HSC a family-friendly workplace. She continues to mentor students, residents, and faculty in both research and career development. Dr. Morrison is a native New Mexican. Her parents still live in Farmington, New Mexico, where she grew up before graduating from UNM in the area of physical therapy as a part of the first physical therapy class, and later the medical school. She did her pediatric and neurology residencies at Johns Hopkins in Baltimore. Dr. Morrison recently chaired the Associate Vice Chancellor for Diversity Search Committee that eventually led to my being here today. I'd like to publicly thank her for her commitment to the Office for Diversity and for her outstanding leadership, which significantly contributed to my being here. I present to you Dr. Leslie Morrison.
Thank you, everyone, for coming. I'd like to also publicly recognize Dr. Gibbs. We have actually known each other for several years. We worked together on a project called Sea Change, which was to increase our diversity with regard to underrepresented minorities in faculty and particularly leadership, as well as women in leadership, and also an element that tried to bring generalist practitioners into leadership as well. So, and I applaud your persistence in coming for our interviews and being the successful candidate, and we're extremely happy and fortunate to have you here. Brian also just came from Baltimore, so we also shared time at Johns Hopkins, and not at the same time, but we both know a lot about the institution and the city. So it's a great pleasure to be here, and I'd also like to thank Tomai for her efforts, ongoing efforts, and the importance of the Diversity Mavens, I think, in its youth, actually, as an organization here at UNM. So let's see, I'm missing page 1 here. Brian, do you have an extra page? So, and I asked Della Willis, who's our executive assistant in the Office of Academic Affairs, to hand each of you an index card. Does everyone have one? They're very important. What I want you to do, there's 3 things that I need. On one side of the card, I want your name and your mailing address. Mailing address, yeah, it can be here, it can be a business address, or it can be your home address, whichever you prefer. What I'm going to do is then have you write 2 things on the other side of this card. At the end of the talk or during the talk, I want to have one thing that you personally want to commit to help with healthcare disparities in New Mexico. And it can be in any arena, but just something that you're going to tell yourself that you're going to do. The second thing is what you're recommending to Dr. Roth, since he can't be here, but as Chancellor of the Health Sciences Center, what he and the rest of his team, what we can do to further the work of the Diversity Mavens, but also toward healthcare disparities, particularly with regard to African American health. That's the second one, okay? Your name, mailing address on one side, flip it over, 2 questions. One is your commitment, what you're gonna do to further work toward healthcare disparities, and the second one is what you want the institution to do. What are your recommendations for us? I will give all of these to Dr. Roth, and then in about a month, we'll mail you these cards to remind you of your commitment and what our commitment is. So I really appreciate everyone being willing to do that. Yes. Either one is fine, whichever you prefer to get the card, whichever is more reliable. So again, thank you, Dr. Gibbs, and all of you for your attendance today. It's an honor to join you here today, celebrating African American History Month. Each February, we pause to appreciate the immeasurably rich contributions African Americans have made to our nation. This year's celebration occurs at a unique moment in our history as we redefine and expand healthcare access. For the first time, there is a realistic prospect that nearly every American will be afforded basic health coverage, but the cost for many will still prohibit access until we work all of it out. So there's a lot more work, I believe, that needs to be done. At the same time, we are seeing a top-to-bottom remolding of the health system. From a model that focuses on curing disease to a preventive model that emphasizes health lifestyles. Years from now, we hope this will be seen as a watershed moment. These issues have long been part of our focus here at the Health Sciences Center. As you know, our Vision 2020 commits us to measurably improving the health of all New Mexicans by the end of the decade. And toward the end of the talk, I'm going to ask you, how will we measure that success? It's very complicated. To meet that goal, we must shift our focus to decreasing health disparity and address the social determinants of health. Those upstream social factors that drive downstream medical problems including preventable diseases, violence, and injury. These social determinants of health are closely interwoven with the still ongoing struggle for civil rights. Dr. Martin Luther King's book, Why We Can't Wait, published in 1963, is a stinging account of the inequities facing African Americans at that time. That book presented an eloquent argument for why gradualism can no longer serve the civil rights movement. Compelled by the inequities and injustices facing African Americans, Dr. King gave his life to end the disparities between ethnicities in this country. While health care was not a central theme of his work, it was beginning to emerge as a leading concern shortly before his death. In 1966, at the Second National Convention of the Medical Committee for Human Rights, Dr. King stated, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." He knew something that we are still working to rectify. So how far have we come? We know all too well here in New Mexico the disparities. In 2013, the Health Equities Report from the Department of Health highlighted the fact that our African American population, though small, experiences disproportionate health disparities. Infant mortality rates for African Americans are the worst among all of New Mexico's ethnic groups, at 13.5 infant deaths per 1,000 live births. The disproportionate burden of infant mortality among African Americans deserves greater scrutiny and underscores the need to mobilize all the resources at our disposal to respond urgently with constancy and clarity. This is a crisis, and it will require the collective will of all New Mexicans in order for it to be fully eliminated. Sadly, we can point to many other examples of health inequity. Diabetes-related deaths among African Americans in our state are second only to our Native American population. The rate of HIV infection among people aged 13 and older is highest in the African American community. Nationally, African Americans also suffer disproportionately from the diseases of obesity, cancer, stroke, and hypertension. These conditions are closely linked to endemic poverty, decreased socioeconomic status, and limited access to quality health care, including prenatal care. Here at the Health Sciences Center, we are committed to addressing these disparities through a variety of initiatives. One avenue is culturally specific and targeted Affordable Care Act outreach and education, making sure that everyone has health coverage, whether through Centennial Care, which is the new Medicaid program, or the insurance exchanges, is one of our very highest priorities. We also see the need to expand community health care centers, along with other community-centered programs like the HEROES. HEROES are Health Extension Rural Officers. Among other things, these HEROES interact with local residents to facilitate their access to services here at the Health Sciences. One of our newest HEROES is Evelyn Rising, who's pictured here. She's based in Hobbs, New Mexico, and she brings a wealth of experience to the job. She's a former newspaper editor and college dean. She's very active in her community and also serves as the 28th president of the National Association of Colored Women's Clubs Incorporated. So we're very fortunate to have Evelyn. The Health Sciences Center is actively building connections with community leaders and organizations and working closely with the New Mexico Office of African American Affairs. Brian Gibbs is going to be working closely with community. I think you have a vast wealth of experience in community work in Baltimore and in Maryland and in other communities as well. So we're looking forward to that. We'll need effective and continuous outreach as the key to engaging the community as partners. We ask the community to be willing to come to us with their concerns and to trust that they will be heard. We know that this is a two-way street, and it's not a matter of just the healthcare experts devising, imposing, and implementing solutions. It's a partnership that we envision. Our scientists and physician researchers are also addressing health disparities by conducting community-based participatory research in dozens of locations around New Mexico. Local residents are helping guide the research agenda. We're asking you, what kind of research is important to you? What will change your life and your functioning in your life? Local residents then are helping us develop this as we tackle diabetes, chronic kidney disease, mammography screening, cancer education, depression, HIV, melanoma, and a host of other medical conditions. We know we don't have all the answers, and that listening deeply is a fundamental aspect of this kind of research. In working to meet critical shortages in New Mexico's health professional workforce, we are also focused on improving both the number and diversity of our graduates, as this will improve health equity among all ethnicities in our state. We expect this will lead to a greater presence of African Americans on our campus and in our leadership ranks. We have a spectrum of pipeline programs. Again, Dr. Gibbs will be very involved in helping us with our developed pipelines and hopefully developing more on campus. We want to expose students and families to health careers and help them stay in school so that they can realize their full potential. These programs, which start in middle school and run through high school and undergraduate education, include the joint BA-MD degree program, which is already producing new doctors. I just was speaking to one of our participants today, and I guess on May 9th they're going to be celebrating both the bachelor's portion and the first full class of BA-MD graduates from the medical school. So that will be a very exciting day, and it'll be very interesting to see where those graduates have come from and then where they wind back up, because we want them to go back to their communities where possible. We must fix New Mexico's health disparities. But we know that effective solutions require a shared consensus about how to move forward and committed partnerships of both private, public entities, but most importantly, New Mexico's families and communities. Working together, we believe we can shape a healthier future for all New Mexicans. Today, we would love to hear from this group about work you've been doing and the ways that we can encourage our leadership to continue Dr. King's legacy, so that one day we can put healthcare inequity behind us. So thank you. So let me have your questions. We can also open for questions and be happy to hear your thoughts about this. I have one more slide. And this is a report card. This is Lee County, where Evelyn is from. And I wanted you to see some of the facts here. These are the leading causes of death in Lee County and in New Mexico, so it's pretty parallel, I would say. A few less unintentional injuries. And so we'll be following these statistics over time. We're also following how much we're trying to track, how much we're interacting with the community, and then we'll see what kind of results that has led to. So you can see that there have been 2,084 hours in Hobbs for the HEROES program. Yes, only 7 hours of research, which is not very much. So we do have a long way to go. So how might I answer any questions? We have other resources. Lynn Mallory is here, Dr. Gibbs is here, April Rodriguez is here. We have a lot of resources. So Joaquin Baca in the back, Holly Buchanan from the library. Yes?
I might just mention that again this year, Facebook has partnered, and I think with Ann, Dr. Simpson, a couple of times we again this year had an exhibit celebrating the month. It's in the lobby of this building as well as in the lobby of the auditorium.
Great. So we should all try to go visit that. It's up until when, Holly?
I'm sorry.
How long is it up?
Oh, Ann, do you remember? It's a couple of months.
Yeah, I think it's so sometime in April.
Any disagreements with the material presented? Any new ideas? Any hopes that we can organize ourselves to get to this very laudable goal? Anyone want to share your commitments that you've written down? or your questions for the Health Sciences Center. Yes?
A little bit more about the HEROES program.
Yeah, the HEROES program is a program through the Office of Community Affairs and Community Health. And Anne, actually you probably are tied closer to that office than what I am, but Art Kaufman and many of the people that work in that office, including Dr. Simpson, are working toward having people who are from the community serve as liaisons, and also I think providing some basic health care information for patients from those areas. And it's been, so far, we have great hope that it's going to lead to improved outcomes. Joaquin?
Well, the other thing that talking with Evelyn is what we've targeted for that community and talked about in particular in everyone is in order to address real substantive and sustainable changes in health outcomes. If you don't address education, and that's from the bottom up, then you're never going to get students even over here in any healthcare field.
Yes.
And so that's a huge issue. One, addressing, making sure that the kids are receiving an education, because in the African American community, one of the primary issues has been that children may be in the school system, but they're not being educated to the same level that other students are being educated. They are not being informed of a lot of the programs that they have going on for students. So Evelyn is also working in that area, because we all know that if you look at social determinants, one first and foremost is without an education, you are likely going to experience very bad health outcomes.
Right.
Some of it we know is genetic, environmental, but a lot of it has to do with education, jobs, and those kinds of things.
Right, and I would say that back to our infant mortality statistics, much of that education occurs at the time of conception and forward. And I think that we really hope that improving things like nutrition. I just heard about a program where the school has breakfast for all children. They start their school day with breakfast. And they've already noticed that the kids are much more alert, they're not drifting off to sleep, they're not acting out, that everybody's set to go, and it's for all children in the school regardless of their income levels or anything. It's just like, because then it's not stigmatizing. It's like everybody just comes and has breakfast and moves on with their day. So prenatal nutrition, and you said from the very beginning, so it really does start in the prenatal stages, but what we're really missing a lot of is that 0 to 3 period as well, and the support that parents need when they're raising infants without many means. So Joaquin, did you have some additional? Joaquin Baca, most of you know, I think, has now moved from the Office of Diversity to the Office of Community Health. And
I just wanted to make a quick announcement.
Sure.
I'm going to be heading down to House this afternoon, actually, so I'll be seeing Evelyn and talking to her a lot about these things that you've mentioned. But one of the other things is Evelyn coming back up on Monday to do some training with the CTSC on some of the research. And
Great.
Looking at different opportunities and approaches they can incorporate into the talk specifically on this. So just as an additional announcement to hopefully improve the numbers with the research.
right, and I would love to meet her. There's time on Monday.
Okay.
Let's see. Go
I
ahead.
work at the VA-MD program, and our program works very closely with Evelyn and Hobbs, and she helps us to target African American students early, as early as their freshman year in high school, so they can be competitive applicants to our program. We get applicants, but a lot of times they don't meet our minimum test score requirements, the ACT or the SAT. So our recruiter has worked on a strategic plan with her to work with these students, because he can only get out there, once or twice a year. But if she's seen these students out in the community or in the school, they've worked out a plan to where she can get to them early, help them with test prep so they can be competitive, and when they apply for our program, they can move on to the interview phase because they've met the minimum test scores.
Right, and as you know, math has been a huge problem, and math is such a teachable thing. There's so many new ways to learn. I don't know if any of you have seen the Khan Academy videos, but he developed those. This is a guy here in the US who had relatives back in India, and he had a cousin who he met at a wedding, and he said, "You should go to medical school, you know, you're fabulous." And then her mom said, "You know, don't encourage her to do that. She's really struggling in school." And so he started teaching her through these tutorials, and then she started sharing them with all of her classmates at school. And then it was the next village and the next village, and now it's worldwide, and it's totally free. So it's a very exciting move in the way we're educating. Anne, you have another question.
Yeah, in terms of what we can all do, there is not one person in this room who can't mentor someone.
Mm-hmm.
And that is what we're sorely lacking in, because the teachers, even if they want to, may not have the time to do that with all of the students. But part of what I'm finding when I'm mentoring students is because of racism, some of our students are not receiving the information or the education. So we have a responsibility to do that. And so there's not one person in this room who cannot provide some mentorship to a student.
So when a student contacts us, I know that in the past, Joaquin has sent many my way from junior high and high school. Do we have a centralized place where students can learn about mentorship and seek it out? Does anyone have that information? That's a great question.
There is, as far as I know, no centralized place. People contact me. I'm very proud of my intern.
Protege.
Yes, from New Mexico State. So, people just.
Would you like to introduce her
Yes.
to the group?
Is it okay, Elise? This is Miss Elise Williams, a senior at New Mexico State, working in community health and applying for different programs now in graduate school, but she's working with me. We're doing a program on social determinants of healthy aging. So you guys will all be getting flyers, and this applies to everyone since all of us get old. So Elise will be helping us and actually doing part of the first talk, which will be next month. Yeah, she's going down the hubs with TJ.
Oh, great.
And you
Great.
later today.
Yeah.
Very busy.
Yeah, she is, but don't give her any extra assignments. She still has to graduate.
She's taken.
Yeah, but she
Dance
still
card
has
is
to
full.
graduate, and that's the most important thing. So even with me, it's like you need, because she's taking other courses too.
Right.
So it's not just this. So, and I have to tell you, she's brilliant. I mean, the things that she has researched I mean, I was just amazed. Kathy in the office, we're all saying, "Oh, wow, did you want to do what Elise did?" So this is great.
Great. We have a question from Bishop in the back.
Yeah, I just think that one of the most important things is to partner with CBOs, community-based organizations, faith-based organizations, and put real dollars and people on the ground. I think when we start talking about community health, and we're going to involve the community per se, at large, to educate them, to build their capacity, to engage them, to empower them, to help solve some of their own health issues. But some of these health issues, they're more than economics. Some have to do with character, ethics, and so you need community partners to actually reach in, who are trusted messengers, to get those kind of things done. I think that the university would serve itself even greater by making sure that they have those kind of partnerships, and they put real funding behind it. I know in the African American community, a lot of times the disparity is more than just the health, it's the funding concerning the disparity. And so a lot of times we lump in the African American community that has their own sense of identity with everyone else, and how they are approached concerning their health care. I worked with HIV/AIDS with CDC, and it's just a whole different dynamic. The same processes work, and then some of them don't work.
Right.
Based on race. And I just think that New Mexico has to, and the university at large has to kind of catch hold to that and make a commitment itself to that.
Mm-hmm. Yeah, I think you're absolutely right that in our state we have so many different cultural sensitivities, and we have to educate ourselves first and our students secondly, you know, to how to approach different aspects of community health. And so, you know, we're probably doing better in some ways with the community engaged research and the participatory research than we are in actually getting out there. Although we do have the urban health curriculum, and we're hoping to really use our interprofessional education forum to get out into community. We have fabulous students, and they are out there doing so many wonderful things. They just did a health fair down in Belen, and they are trying to get down to the new health, I can't remember the name of it. Cindy Arndell and her group have this big healthcare center, and the students are participating in that, and they're doing it in teams of a pharmacist and a nurse and a doctor and a PA and a physical therapist. It's really quite fabulous, and I think that is a way to expose a lot of the community students to healthcare careers as well. Joaquin?
I want to continue the thought with Bishop Cooper in terms of, this is a policy level kind of thought, though. Here in the United States, we tend not to fund a lot of preventative care in general.
Right.
Unfortunately, that's...
We fund illness, not wellness.
Yeah, and it hopefully will change with some of the things going with work care and the team-based practice. And
Right.
Patient-centered care is a really big part of that. And hopefully segregated culture will start to shift around that. But unfortunately, the current time, a lot of the preventative care gets left out of that funding in general. And so I think from our perspective in community health, that's one big area that we hope to advocate for more and try and find ways to diversify funding into communities much more readily and find ways of creatively solving that issue. So partnering with the community organizations, but also with things like NGOs and managed care organizations and with other profit organizations or foundations to bring money into communities to help with the rest of these situations.
Right, and I think that term that I use, gradualism, is a very slippery slope. And we have been making baby steps gradually, and we probably need something much more cross-cutting to impact health. Were there other questions? Yes?
What about utilizing social media?
Mm-hmm.
Like your
Can you
Facebook?
teach us?
Well, is Facebook just about like all student organizations, all schools use Facebook, and you could, create a Facebook page, promoting the BAMD program, promoting tutoring, because, all you have to do is just get a student to like the page, and you can post notifications or updates or even links, and they'll have access to it. It's just not everyone has the app or checks it at least 3 times a day, so that's one way.
Right.
And you could, get in contact with student coaches, because I remember when I was in college, that's how, well, I am in college, when I was involved, we had to have a Facebook page, and that's how we got our notifications about practices, and you could, just post information that way. So.
That's a great suggestion. I think, Twitter is right there as well.
You can post links to Twitter too, and it's not that hard just for a student to take a look at it that's interested.
Yeah. Yeah, we're still in the sort of online education phase, and we have a long way to go. Holly, do you have any comments on Facebook pages or?
No.
We like to think we're early adopters of technology, but there's a generation gap. Tomai?
I agree big time, and I wanted to ask about the BAMD program. How many African Americans have been recruited into this program over the past few years, and are we looking at a graduation rate? Is there a failure rate, or do you have any statistics about that? I'd like to be.
Do you have that?
I don't have the numbers
It's
on
so
hand,
early.
but I can get it to you.
Yeah, we do have some recent statistics from the BAMD program. Their MCAT scores, their ACT scores, and those kind of things. And I think the Office of Diversity can share that.
So I actually am the faculty advisor for the Student National Medical Association. And we now have, I think, 2 students who are BAMD, African American young women who are there. I know that we had at least one of the first classes, we had a student, but she decided that medicine wasn't the thing she wanted to do, and she chose another path. So there have been some, I don't know the numbers for all of them, because at one point I was part of the mentoring group, but then they changed it and they sort of dropped me from it, so I don't know where they are now.
But if I'm counting right, does that sound accurate to you? 3?
No, there's more than that.
More
Yeah,
than
that's
3.
what I'm saying, I
Okay,
don't know.
so if that was the case, that would be 3 out of what, 120 BAMD students, or actually more than that.
Yeah,
That would
it's
be
been
times
more than
8.
that.
Yeah,
Yeah.
it's 30 times 20.
There's 28 a
25?
year.
Yeah,
And they
28
started out
times 8.
25 a year.
And we may, I mean, just a ballpark number, so you know, we may have 2 students per cohort of the 28.
So 2 out of 28. Uh-huh.
That's been more recent, because at one point you would have classes where there were no,
Yeah.
so I would, yeah.
Yes.
Last
Mr.
number I
Cooper?
got from Dr. Ross was around 11. I don't know if he included the 2.
Oh, okay. Up to date? Uh-huh.
BAMD.
BAMD. Okay, thank you.
I'm sorry
Yes,
if I missed
ma'am.
this, but are you guys actively recruiting in high school, you know, starting out early? Because as you know, to get those scores, you can't be a senior to that.
No, and that's been one of the discoveries, is that the students from more rural areas were having more trouble, particularly in the math and their scores, their acceptance scores. So Joaquin, I know this isn't your job anymore, but can you tell us a little bit about the high school recruitment programs?
When the DAU, I'm not sure where like it is with the directors, but Officer Diversity really didn't have a lot, but I did keep track of recruitment in general. And one of the things about DAU, they only have one recruiter for the whole program. And so he really is kind of charged with doing the whole state, basically.
It seems like they need to link up with the heroes.
Yeah, and that's what we've been
Pretty
finding.
quickly.
The next DAU does help to pay for the hero work, and so the
Right.
heroes are actively involved in the communities to recruit very directly. And I think Evan is a fine example of that there. But we need more concentrated effort, I think, locally, and I'm right in transition, so I don't know
Where things are. But the heroes, just so you know, that it was modeled after the agricultural programs. And they realized they had these county extension agents, and so these were people who lived in the community, came from the community, and then went back to the community and are paid. You know, so our heroes have jobs. They're part of our UNM staff. Yes, ma'am.
I just wanted to say, I also want to make sure that people realize a couple of things. One, Evelyn is in one area, southeastern New Mexico. And the other thing is, some of the Black students who have gotten into the BAMD program did not hear about it through the schools. Some of them found it themselves looking for things online in terms of what are their next step, what school,
Yeah.
where places to go.
Mhm.
So yes, there may be one recruiter and they may be contacting counselors in schools, but that stuff is not getting to our students, which
Right.
is where I go back to education.
Yeah.
And the
mentorship.
need to mentor students and to give them this information, because it's not getting
Well, I can speak from personal experience. My daughter found out about, she's here in New Mexico, in Rio Rancho, and
She didn't hear about
found
it.
out about it through those types of.
Right.
Right. I happened to be on a plane one time with this teacher from the Navajo Nation. She was, and she had never heard of the program. And this was probably 3 years ago, and I was heartbroken because it was a relatively large high school system, and she was teaching the gifted students. So.
And incredibly, in terms of the numbers of applicants, the number of slots available, so that's part of the issue, because there's only 25 slots, but they get well over 400 applications per year. So in terms of the competitive.
It's very competitive, yeah.
Is more broadly gets known and actually gets more competitive.
Right.
So that's another thing to think about in terms of targeted recruitment versus broad
Was there another question back? Yes.
I once worked for Texas A&M, and we had a huge diversity just for the admissions office in general because the population was predominantly white, and we needed to up those African numbers. And Texas A&M was an extremely difficult institution to get into stores and all that. And so one of the things that we did was not only looking at high school kids, because as an African American, there are, if you're a first generation, I'm the only attorney in my family, and on my mother's side, I have almost 80 first cousins, and I'm the only JD in the group. And so when you start talking about African American children and reaching out to them, it shouldn't just be a high school initiative. You know, we went to elementary school.
Right.
You know, even if it was just once a year, we did it. Middle school, because these kids aren't aware of any of this stuff, and then you can't wait until their 9th grade year and say, oh, don't you want to be a doctor? Because they don't have any clue what that means. They don't know what educationally that means. They have no idea what the challenges are. They don't know. And so you don't know what you don't know, and if we're not educating them early on, because elementary children they get excited about things. Middle school kids, if you give them something to hope for, they do it. So maybe there's some outreach opportunities, not just in high school, but also other ages.
Yeah, junior high. I mean, as we were talking about, it really starts at the very beginning. Did you have another comment to add? Because Lynn is here, and he works at the College of Nursing.
Yeah,
so.
And previously I worked for state government on higher education, and one of our initiatives were P through 20 pipeline pathway issues, and certainly trying to increase the number and educational performance of students of color. You see the numbers, and it is pretty startling in terms of the math and the sciences, which are critical to success. And if you have, I think, sort of advocates and mentors that look like them in their communities, to be able to go into the classroom at the K through 12 level, and say, hey, these are some careers that are open to you in the healthcare arena in particular. This is what's needed. I did it. It's pretty impactful. So, but I think it needs to be structural. I think it needs to be, purposeful. It needs to be strategic.
Well, and the math and science teachers are such a great liaison, to the students. We also, reminded me, I'm going to get you in just one second, we're working with UNM West in Sandoval County because we have Sandoval Regional Medical Center, and we're trying to look at health careers and technical careers out there. And so we're working with the high school, and we've tried to get the junior high principals in our academic engagement committee. But they certainly have some wonderful programs there. So we thought if we could have them come to Sandoval Regional, see what's there, develop the curriculum at UNM West so that it's suitable for health science careers, that it would go a long way toward getting those students channeled. I don't know who was first. Go ahead, Bishop Cooper. Okay. Thank you.
So I just wanted to encourage people to even think younger. Phil Croft, one of my faculty members, today went to Dad's Day at preschool. And he's an internist, and so he took his stethoscope, he took his an x-ray of his daughter's heart, talked through them. They loved it. My daughter was in med school, first through third grades, and he took me to his medical school classes. And that was a very foundational thing for my future career, what I thought I was going to do. So just go even younger. I mean, I think that's when the kids really get an idea of what they want to be.
Yeah. Well, this has been, yes, Bishop Cooper. I almost forgot you after you were so kind. Yeah, you wouldn't let me.
I just think again that, and I hate to beat the same drum, the university can only be in the community once a year, twice a year, but you've got people in the community every day.
Right.
Every week.
The doctors, the nurses, the teachers.
The doctors, the nurses,
the community, the pastors,
leaders, everything from the head of all of the Greek groups in the black community, lodges, National Council of Negro Women, 100 Black Women, ASAS, plenty of people that can actually do the work, that the university can pull from that pool of people who have advanced and progressed from elementary, because there's social issues here. There's a bunch of issues that me going to a high school or elementary school, telling them that, you know, I graduated from this college, or you can do this.
Right.
That's wonderful. But what's the follow-up was even with the school teachers. I mean, the school teachers, once they're done with class, most of them are done. And they got enough homework to do themselves, lesson plans, their own families. But there are people in the community who are so committed to these issues. And the university may have to create a new model for getting this done, how serious we are, because whenever you're in a minority-majority state, the minority of that state always has the disparity, and there has to be some real commitment beyond just saying we want to change this, we want to do this better, but to actually get in and work with people that can make change. And so that's my last comment.
Right. Well, thank you so much. Alexis?
Yes.
Nice to see you.
Thank you. I'd like to piggyback on what Bishop Cooper is saying, because I think we're forgetting something that's very important in this whole process. One of the things that attracted me about this talk was the word hope as the first word in the announcement. And nursing and pharmacy have done a great job. Joaquin and I were looking at the data last year, and we noticed that they have been able to track those students who don't complete the program in the time that's stipulated. And many of the reasons for them are, family sort of community sort of issues. And I think a lot of it has to do with first generation people who are more people in terms of what the priorities are for some of these students. And I think in changing the paradigm, which I think is what Dr. Bishop Cooper is inviting us to do, we need to think of ways to embrace that sort of cultural dynamic that puts family first for folks in the community, but at the same time have community folks help a lot of the people who go through these processes, and sometimes make them understand that in dealing with those issues in the family, there may be ways for them to still do well and not lengthen too much their time in school or whatever.
And their
happens
loans,
with, because
yeah.
The numbers of these students are interesting in terms of their composition. There's like a number of African American, Hispanic, Native American students who are probably in this particular category. And you guys probably know that pharmacy and nursing are not like the School of Medicine. School of Medicine has a full-fledged sort of support system with advisors, and they meet with the students. They have a much more established institutional basis to dealing with those things, which goes back to funding, right? Goes back to where the resources are. So I think that's one of the best practices that we already have in place that could be reached by bringing in these community components. And I don't know exactly how it would look like, but it would take us way out of our boxes.
Right.
And it would make us think more in terms of retention and student success, and not just in terms of recruiting people who are going to come here and will be, perhaps struggling when things happen in their families, etc., and those things. So we need to find ways to not just say, well, that's something we cannot do anything about it, but think that there are many ways to connect these people in the communities,
right,
and refer them to something that gives them a support.
And it builds resilience,
Yeah,
which
exactly.
you really want. Everyone has. We just need to figure out how to bring it out.
Right, and these people may graduate later, etc., but if there is more support, maybe that process of lengthening can be reduced, or we can do something about it. to pay special attention to those situations.
Thank you, Alexis. We had one more question that I neglected to recognize. So Joseph?
I lost it.
Uh-oh.
So no, I was just thinking of another vehicle would be looking at the area health education centers, the
Yes,
AHECs.
Mhm.
I mean, that could certainly be a vehicle to use to kind of bridge this notion of mentorship or preparation.
Right.
Because that could, I mean, we already have 4 of them in the state, I certainly could use more.
Right, and it's had a great history, actually, for helping us produce healthcare providers in the state. So it is an untapped resource, I think. Tomai?
Yes, I'd just like to say thank you for having Dr. Leslie Morrison with us today, and I want to present you with a letter from the Diversity Mavens for Dr. Roth, who wasn't able to
Okay,
make it today.
I will pass it on. But I also, excuse me, before we finish, I want all of your cards, if you can pass them down. We will give these, as I said, to Dr. Roth to look at. No phone numbers. Yeah, thank you. And then we're going to mail them back to you. So don't be surprised if this, it may come in an envelope, but it will come back to you. And I really